everyone, good afternoon, and welcome to our session on farm workers and heat-related illness. Our presenter today is Joan Flux, and our presentation is going to consist of two parts this afternoon. There's going to be first the presentation, and then right after that, we're going to go into discussion groups. And we're going to provide guiding questions for you to talk about the presentation and give us ideas and recommendations that you would like to share with us. As I said, our presenter is Joan Flux from the Levin College of Law from the University of Florida. And I will turn it over to Joan.
Thank you, Myra. Hi, I'm Joan Flux. I am the Director of Social Policy at the Center for Governmental Responsibility, University of Florida College of Law. And I'm also the Director of Emerging Issues at the Southeastern Coastal Center for Agricultural Health and Safety, also at the University of Florida. And I'm going to talk a little bit today about heat-related illness and farm workers. First slide, please. So everyone's probably experienced a symptom related to heat exposure at some point because symptoms can range from mild, like headaches or heat cramps, to serious, like heat exhaustion and heat stroke, and sadly, even death. Very basically, what happens physiologically when we're exposed to heat through example, physical activity in hot weather is that your core body temperature, as your core body temperature increases, blood is rerouted to your skin's periphery to make you sweat. And sweating is good. Sweating cools the body down. Then things that can influence how well this thermoregulatory system reacts are some of the things that can influence this are acclimatization, hydration, and aerobic fitness. If your system isn't working well, or if the conditions are too extreme, then there can be negative effects on other organs because, as you can imagine, as blood is going to the periphery to make you sweat, it's not able to be used by other things in your body, other organs. Next slide. Extreme heat kills more Americans every year than any other weather-related disaster. And as we all know, heat waves are growing in intensity and frequency. And there are inequities in the amount of heat that different populations experience. And these are related to a number of social and economic factors that can influence this. Populations most disproportionately affected by heat and subsequently heat-related illness include the elderly, children, low income, and outdoor workers, including farm workers. There's been, for example, a lot of recent attention about the link between low-income urban neighborhoods and greater impacts from heat. You may recall certain heat waves in urban areas that caused deaths among certain populations. A recent study found that in 108 urban areas nationwide, formerly red-lined neighborhoods in nearly every area were hotter than non-red-lined neighborhoods, including some by nearly 13 degrees. Some of the reasons for this are through what's called the urban heat island effect, where non-green spaces with pavement and concrete absorb heat and release it more slowly than green areas. And added to that, if you don't have the means to cool down, for example, through air conditioning, the problem becomes even worse. So other populations, including the one that we are focusing on in this symposium, occupational communities like farm workers are also a high-risk population. In fact, their risk for heat-related death is nearly 20 times greater than for other outdoor workers, as Dr. Pagan mentioned yesterday. And in Florida, farm workers, for example, work intensely outdoors all year round. And they often do not stop to take water or rest breaks, especially if they're working at a piece rate. Next slide. Slide. Oh, no, back one, thanks. Okay, some of the reasons why farm workers are disproportionately affected are similar to the same reasons why this happens with pesticide exposure as well. There are social and economic factors that place them in a position of little control over their workplace environment. And then this is just exacerbated by an ineffective regulatory scheme. Again, similar to pesticide exposure and the ineffective regulatory scheme that controls pesticide exposure. Next slide. In 2016, the National Institute for Occupational Safety and Health and experts came together to update this document, the criteria for a recommended standard for occupational exposure to heat and hot environments, which had not been updated before that since 1986. The American College of Governmental Industrial Hygienists sets limits for core body temperature that a healthy worker can be repeatedly exposed to without adverse health effects. And this limit is 38 degrees centigrade, which is 100.4 Fahrenheit for workers that are not acclimatized, and 38.5 degrees centigrade, 101.3 degrees Fahrenheit for those that are acclimatized. Workers' core body temperatures should never exceed this. Next slide. Okay, so to determine how much workers' internal core body temperatures were exceeding this during a certain period of time, so many work days, researchers from Emory University and the Farmworkers Association did some research several years ago. This was the Girasoles study, which was mentioned yesterday. And I am fortunate enough to be a part of this research group. This research was to study conditions that expose Florida farm workers to heat stress. And we enrolled about 250 participants and used a variety of tools to monitor things like internal core body temperatures, the environmental temperature, the amount of physical activity the workers were engaged in, and certain effects on certain biological specimens like blood and urine. The tool that was used to record internal core body temperature was a monitor, and unfortunately there's not a picture of it on this slide. It was a monitor that workers swallowed. It was like a pill, a big pill, that allowed there to be a monitoring of their core body temperature over a period of 3 days. We followed them for 3 work days. And then again, the other tools in this slide monitored other things. Next slide. Next slide. Thank you. The most common symptoms of heat-related illness that were reported by the participants were headache, excessive sweating, and dizziness. Other symptoms included nausea, vomiting, confusion, fainting. Next slide. Here are some results from the study. Our research showed that many workers were, now remember, hydration is a very important way to counter the effects of heat exposure and heat-related illness. But our research showed that many workers were dehydrated even before they began their workday, and even more so after their workday. That 90% of participants exceeded the heat stress limit, which you'll remember is 38 and 38.5 degrees centigrade, on at least one day out of the 3 during which they were monitored. That 42% of the participants developed 3 or more symptoms of heat-related illness on at least one day out of the 3, and that 35% developed acute kidney injury on at least one day of the 3. Next slide. Okay, so what's recommended for outdoor workers to diminish the risk of heat-related illness? Very basic, simple measures: staying hydrated, taking frequent water breaks, wearing appropriate clothing, loose clothing, clothing that's breathable, taking rest breaks in the shade, especially when the temperature exceeds specific limits. But as you can imagine, there are barriers for farm workers to achieving these recommendations. Next slide. Okay, this is the final slide. Occupational heat is not federally regulated beyond the general duty clause of the OSHA Act of 1970, which holds, as it said here, that each employer furnished to each of its employees a workplace that is free from recognized hazards that are causing or likely to cause death or serious physical harm. A very broad, just as it says, general duty clause. OSHA has issued general recommendations and designed an information campaign for the protection of all workers in all hot work environments. And these things within this campaign include things like water, rest, and shade, like we just talked about. But there are no federal policies existing for protecting workers from heat. States are allowed to adopt more stringent requirements, but as of the date, very few states have implemented a stricter heat standard. The info on this slide, I think, is a little outdated. California, Washington, Oregon, and Colorado have implemented stricter standards. Minnesota has a standard for indoor workers. Finally, after much advocacy, OSHA has finally begun the process of drafting a federal heat standard, which is now in the rulemaking and public comment phase. I just want to say one last thing about the barriers with any regulatory scheme designed to protect disenfranchised groups like farm workers. A combination of factors makes implementation and enforcement very difficult. For example, if a standard like pesticide regulation depends on reporting by a worker, you must take into consideration the social and economic factors that make workers very reluctant to report violations. Workers that lack control over their living and working conditions, that are undocumented or are not organized, or that may only know a crew leader and not the owner of the fields where they are working, are not in the best position to challenge adverse conditions, especially if there are conditions that, as of now, are deemed lawful because of faulty regulation. Okay, that is it for my presentation. See some questions.
Thank you, Joan. So before we go into the breakout rooms, we are going to take a few minutes to address the questions in the chat. If anyone has any additional questions, please feel free to put them there. So the first question, Joan, is, can you define acclimatization?
Mm-hmm. Sure. Acclimatization is a period of time for a worker or anybody actually working in heat. It's the time that it takes for their body to actually get used to the heat. And it's a very important process. There are recommendations for how long workers should be working outside before they're considered acclimatized.
Thank you. And we also have a question of what do you mean by medically cleared workers? When do they have to be medically cleared? And what is the frequency required during a work season?
I'm not sure where in my presentation I said medically cleared. Workers don't have to be medically cleared. Not even temporary guest workers under the temporary guest worker program. It may vary from state to state. I don't know what California regulations are. I don't believe that there's a regulation that workers be medically cleared. You may have been referring to acclimatization. Again, there are recommendations for how long workers will work before they're used to the heat. But there's no requirements for medical clearance for a farm worker.
And someone also asked, can a farm worker develop acute kidney injury in one single day of work?
I don't know the answer to that. I do not think so. I think that acute injury, unless it's an extremely traumatic event, there's a lot of uncertainty about acute kidney injury. Right now there are in other countries actual epidemics of mainly farm workers that are developing acute kidney injury of unknown origin. And it is exactly what it sounds like. They're not sure what is contributing to those pandemics. So I don't think in one day of work you can. I'm not a medical doctor, so maybe someone else is better equipped to answer that. I don't think so unless it's an extremely traumatic event with something that we may not know much about, maybe an extreme chemical exposure or something like that.
And we have one more question. Where can we find the recommendations for adjusting to working outside?
I believe that you would be able to find those and in NIOSH, with NIOSH, if you can navigate a website for NIOSH, you may find recommendations there. I would not be surprised if some of our nonprofit organizations like Farm Worker Justice or some of the other organizations also have some policy documents or some recommendations. I know that the Farm Worker Association of Florida does training on this. They may have information. So I guess I would steer people towards any nonprofit organizations that is working with farm workers to see what kind of training material they have. Or also some of the agricultural, the ag centers, the NIOSH funded ag centers that are all across the country, like the one that we have in Florida, the Southeastern Coastal Center. They also have training materials on their websites.
And speaking of materials, last year Farm Worker Justice, together with Migrant Clinicians Network, published a clinician's guide on heat-related illness. So if you'd like to find more information about that, you can find it on our website.
There you go.
Thank you again, Joan. That was a great presentation.